Stand by SOT1.
Standing.
10 seconds. Ready, roll in. Ready, SOT1.
Ready.
In 4, 3, 2, 1. Roll in.
From legendary Uncle Studios in beautiful Southern California, welcome to another edition of Work Comp Matters, the central location for you employees, you employers, and of course, we haven't forgotten about you damn independent contractors. And now, here's this week's edition of Work Comp Matters.
It's February 7th, 2022, about 2 minutes after 12 noon straight up. Welcome to another edition of Work Comp Matters. We are sponsored by mancavepodcasting.com. We have almost 700 podcasts in the tank. They're completely free, no obligation, available to you 24/7. And if you want to do your own podcast, all you have to do is talk anywhere in the world. All you need is a smartphone or a computer. 818-357-4120. We will manage, produce, direct, get your content streamed live and in the cloud forever. Thank you very much for joining me. My name is Steve Appel. I'm joined by the madman across the water, the socialist voice of reason in Munich, Germany, Mr. John Scalia. Stories in the news today that both John and I believe are of interest to you, California employees, employers, and independent contractors. Health experts criticize possible Kaiser Permanente deal. COVID mystery discovered in California sewage. That sounds like another shitty story. From NBC News, 900,000 dead. COVID deaths are surging in low vaccination states. From CNN, U.S. reports more than 900,000 total COVID-19 deaths. From the Washington Post, President Biden marks 900,000. From the Los Angeles Times, in rural California, the unvaccinated and overwhelming hospital staff. From City News Service, Los Angeles County reports another big drop in COVID hospitalizations. Thank goodness. From the Bakersfield, Californian, county touts health programs amid heightened COVID deaths related to unhealthy lifestyles. Tell me something I don't already know. From NBC News, low income, uninsured face hurdles to obtain COVID antivirals. From the San Francisco Chronicle, experts chart Bay Area life after COVID and when it might arrive. From the Los Angeles Times, private schools snub Los Angeles County inspectors checking COVID-19 rules. From Berkeley side, Berkeley School Board considers lifting some COVID restrictions. From the Bay Area News, Contra Costa County gym vaccination verifications are now lifted. Again from the Los Angeles Times, inside the requests for religious exemptions from COVID vaccine. Cal Matters, the Omicron effect when city halls, state agencies close their doors. Those stories, maybe more, maybe less, are going to follow in the next 24 minutes on another edition of Work Comp Matters. Now he's out in Munich, Germany. He's been my co-host for years. Mucho thanks and kudos for coming on in. Once again, Mr. John Scalia. You got the first story, sir.
Okay, this is a story which we actually reported on originally, I believe, on Friday. It's a follow-up. California's no-bid contract with Kaiser triggers concerns. Other California health insurers say the special deal is unfair and could leave them with high-need patients. State health officials counter that Kaiser is a unique provider with limited capacity. Unique means they're a big contributor to Governor Newsom. State health officials have proposed a no-bid contract that will allow Kaiser Permanente to expand its Medi-Cal coverage area, triggering anger from other health insurance plans and questions from a key legislator. The proposed contract, which would begin in 2024, allows Kaiser Permanente to skip a bidding process required for other commercial insurers to participate in Medi-Cal, the state's health insurance program for low-income residents. The bidding process for all other insurers starts Wednesday. As first reported by Kaiser Health News, and as I read to you the other day, the state's special deal with Kaiser Permanente has raised concerns among other Medi-Cal plans. They say Kaiser Permanente is getting special treatment that bypasses state procedures and allows it to cover only certain portions of the population. Nonprofit local health plans, which cover the majority of Medi-Cal enrollees, estimate that Kaiser's expansion could strip them of up to 30% of their members in some counties. So the article goes on. The basic part of it is that Kaiser has a no-bid deal with the state, which they negotiated with Governor Newsom, and they're one of his big political contributors. And this would allow them essentially to cherry pick people for their program, which leaves the rest of the state providers with the people who are going to run up the biggest bills around. Steve.
President Joe Biden on Friday urged all Americans to get vaccinated as he marked another tragic milestone in the coronavirus pandemic. 900,000 American lives have been lost to COVID-19, he said in a late night statement. There were beloved mothers and fathers, grandparents, children, brothers and sisters, neighbors and friends. The death toll would have been higher without coronavirus vaccines, Biden said, estimating they had saved more than 1 million American lives as he urged unvaccinated Americans to get vaccinated. Get your kids vaccinated and get your booster shot if you are eligible. John.
Well, again, this is a follow-up story, and as you know, I'm big on finding out what the shit's going on. The head of this story, literally, I'm not making up the head. It says, "Poop sleuths discover mysterious coronavirus in California sewage." A mysterious lineage of the COVID-19 virus containing a large and startling collection of mutations has it. I mean, I'm sorry, but does anybody else find it funny that you're talking about crap having mutations? Has appeared in California's wastewater system. Proof that the fast-moving pathogen is continuing to test new survival strategies. Oddly, the virus has been found only in poop, not people. First detected in an undisclosed community by UC Berkeley scientists. Now I have a question. I mean, really? I mean, this is a state secret? Literally? We can't disclose where this was found? No, our shit's secret. Unbelievable. It has shown no signs of causing illness. It has led to no new outbreaks. So where is it coming from? Well, they're not going to tell us, are they? And should we worry about it? No one knows for sure. Well, actually, I do think we know where it's coming from. We just don't know which area it's coming out of. But its troubling constellation of genetic changes, similar to those seen in the Omicron variant, might make it more transmissible or I'm sorry, I can't read that with a straight face. I mean, if it's only in shit, why is it more transmissible? I mean, is there some weird phenomenon going on that I know nothing about? Here's what else is weird. Very similar cryptic lineages, viral fragments with novel patterns of mutations have been found in the sewage of other cities, such as New York City and St. Louis, Missouri. These findings were published in the journal Nature Communications on Thursday. Similar discoveries, not yet published, have reportedly been made in other US cities. Okay, what? I mean, it pretty much leaves one speechless, doesn't it? Steve?
Yeah, all I can say is, and according to the story, it may be transferable. It may just be a bunch of shit. Couldn't help myself. Sorry. From the San Francisco Chronicle, experts chart Bay Area life after COVID and when it might arrive. Coronavirus cases have plummeted across the Bay Area since the peak of the Omicron surge a month ago, and health officials increasingly are talking about the next phase of the 2-year-old pandemic, specifically what living with endemic COVID might look like. But first, it would help, these officials say, to define what endemic means, or rather what it doesn't mean. Yes, we're starting to hear this word more and more often now, endemic. I think it would be good for everybody to know what the word endemic means. John?
Well, endemic means that instead of being a pandemic, which means it's a huge health threat to everybody on the planet, theoretically, endemic means it's more like the flu or a cold, which means it's going to be around, it's going to be seasonal, it will have its share of casualties. I mean, if you Google how many people die from the flu each year, you'll be surprised. So what it means is it's settling into where it's going to be a normal part of getting sick every year, basically. And that's the difference between that's the difference between endemic and pandemic. I mean, when you get a cold once a year, you don't really think that anything, incredibly unusual is happening. It's just normal. I mean, I think it's normal. And it's probably not going to kill you. So that's the difference between a pandemic and an endemic. Okay, the next article is about my favorite county in California, which really should be relocated to Kentucky or Appalachia or Kansas or someplace besides California. It's the place where that lunatic McCarthy is the congressman. It's San Joaquin County. It's the breadbasket of California. Bunch of dirt farmers, yeah. County touts health programs amid heightened COVID deaths related to unhealthy lifestyles. Okay, and where's the article? It just disappeared on me. Sorry about that. Anyway, what it points out is that the Kern County is one of the least healthy places in California. Shock. And that led to deadly results during the coronavirus pandemic. Now listen to these stats, folks. A total of 78% of all Kern County adults are considered overweight or obese. Yeah, 78%. And more Kern County residents die from diabetes than anywhere else in California. During the pandemic, more than 50% of all COVID-19 deaths have occurred in people with obesity, diabetes, hypertension, or heart disease. What a shock. I mean, you've been hearing me say that probably, so you're sick of me saying it, pretty much since this pandemic began, in which I kept pointing out to you that, in my opinion, comorbidities are probably the most important thing in terms of dying from the disease. And I've also pointed out that I personally am 75 and I'm still kicking. Anyway, Steve.
Navigating insurers' methods for getting reimbursed for an at-home COVID-19 test can be complicated. It usually involves cutting barcodes off the box, filling out an online form, then printing that form and mailing it to the insurer. Detroit entrepreneur Ian Sefferman and colleagues in Seattle have streamlined that process with a new website called Good Bill. The site and eventually coordinating mobile app works by uploading your insurance card and the appropriate codes on the test and automates the reimbursement process for the user. John.
Okay, low-income uninsured face hurdles to obtain COVID antivirals. This is a quote. I've had 4 or 5 different patients die from COVID when I've had the pills to help them and couldn't give it to them, one pharmacist said. When Regina Chirac and her 85-year-old father began to develop COVID symptoms last month, they went to get tested at a pharmacy in Midway, Georgia. After the test came back positive, their pharmacist, Pete Nagel, said they had 2 options if they wanted treatment. Get a doctor to write a prescription and then return to the pharmacy for the newly authorized antiviral drugs, or get 4 monoclonal antibody shots right away, 2 in the arms and 2 in the stomach. Ouch. Chirac, 59, who had to quit her job to help her ailing father, knew going to the doctor wasn't an option. She didn't have one for starters and wouldn't be able to afford one without insurance. So she and her elderly father, both of whom had been vaccinated, spent an hour in a cold parking lot waiting to have needles poked in their arms and bellies. It took a while, and you have to sit waiting outside for it all, so I was worried that it'd start freezing, she said of her father, who suffers from memory lapses. The shots, it's just so much harder than getting some pills and going home, but would have to pay out to see a doctor in an urgent care or emergency room. Though the COVID antiviral pills are an easier, cheaper, and more effective method of treating the virus, they're not easy to obtain, especially for those who are low income or uninsured. The 2 pill options, Merck's Molnupiravir and Pfizer's Paxlovid, each require a prescription from a doctor, and the treatment has to start within days of a positive coronavirus test and the appearance of symptoms. Both are considered to have risk. So it goes on. So in other words, the whole point of this is that pharmacists have these medications. They know what they're for. And this pharmacist knew exactly the medication that this person needed. But because the law is restricting who gets to prescribe, pharmacists can't give you that medication, even though they know that the test is positive and this is the medication for it. So the question is, that's basically so insurance companies and doctors make more money, and we make sure, people aren't getting the meds unless they go through the official sources. Now, the establishment will say, and I'll say this for them because I know this is what they'll say. They'll say, well, yeah, the reason we have that is we want to make sure that only people who are medically qualified are prescribing the medication. It has nothing to do with lining anyone's pockets. Right. Steve.
The number of COVID-19 cases, while still high, is beginning to decline at Berkeley schools as the Omicron surge starts to recede. Last week, 171 students tested positive for coronavirus, compared with 203 the week prior and 285 the week of January 9th. Before the Omicron surge hit, BUSD's typical weekly case count was in the single digits. John.
Private schools snub LA County inspectors checking COVID-19 rules from the LA Times. Trinity Classical Academy in Santa Clarita, where I used to live, was fined $500 last winter after a health inspector stopped by and reported maskless students were doing outdoor activities that, quote, did not adequately promote physical distancing. Nearly 9 months later, when another inspector went back to check if Trinity was following COVID-19 rules, it was hit with another citation, this time for refusing access to the health inspector. Access, you get that? They wouldn't let him in. The LA County Department of Public Health said schools have been generally cooperative with its inspectors. Only 9 schools across LA County have been cited for violating COVID-19 health orders as of January. But a few schools have repeatedly thwarted LA County health inspectors from accessing their facilities, bringing on citations and fines. It is a standoff that has played out as schools have become contested grounds nationwide for COVID-19 measures such as masking. County citations state the Trinity Classical Academy denied access to a health inspector not just once, but 3 times last fall, each time spurring another $500 fine. In January, the school was facing a coronavirus outbreak affecting 7 students and 1 staffer, according to public health records. Now it goes on, it names the other schools, but here's the thing about it. And of course, the article basically, again, because everybody in America is afraid to talk about religion. Oh my gosh, all these schools are basically evangelical Christian schools. And so obviously they're hotbeds of, you're infringing on my freedom by making my kid do this or vaccinating people or whatever. And once again, the American press shows its true lack of testosterone by refusing to deal with the real issue here, which is the fact that religion is once again rearing its ugly head and interfering with public health. Steve.
Restaurants and gyms in Contra Costa County no longer will have to verify the vaccination status or recent negative COVID-19 test results of their customers after the county reached its targeted vaccination goal, health officials said Friday. The decision to lift the requirement came as health officials announced that 80% of its residents have been fully vaccinated against COVID-19 and its variants. I find that fascinating, John. I didn't know that they had fully vaccinated for the original COVID-19A. They then had COVID-19D for Delta, and then also Omicron. I didn't know there was anything out right now that covered all 3, or that there was an individual one for all 3. I don't understand.
I'm not sure either. All I know is they just keep telling us to get more shots.
That is from the Bay Area News Group. John.
U.S. death rate may finally begin falling. Ottawa declares state of emergency amid wild protests. Live COVID updates. Daily U.S. deaths from the most recent coronavirus surge may finally be ready to decline. Most states are now reporting fewer deaths than they had been a week ago. A USA Today analysis of Johns Hopkins University data shows just 20 states reported increasing numbers of deaths compared to the previous week. That number was 34 states a week earlier. The US continues to average about 2,400 to 2,500 deaths per day, a daily human cost about equal to the losses at Pearl Harbor. The US reported its 900,000th death on Friday. If the pace of American deaths falls at the same rate it increased during the current Omicron surge, the nation will reach 1 million fatalities in about 55 days, or the beginning of April. The world must wait to see whether another variant will push the numbers higher again. We need to be cautiously optimistic, said a person whose name I cannot pronounce, an assistant professor and director of diversity at the Butler University College of Pharmacy and Health Sciences. Considering the surrounding circumstances, including the spread of the virus still, it won't be very useful to the public to expect Omicron to be the last variant. Now, there we go. It's the unending. This is about like the war on terror, right? It just keeps going on. And again, the United States, the richest country on earth, basically has more deaths than anyone. Now, it may be that other countries actually have more deaths, and their statistical reporting is either purposely or just hopelessly inadequate. But in terms of officially reported deaths, the United States leads the globe. Steve.
Well, there's no good time for a town to be hit by a worldwide pandemic and successive waves of highly contagious variants. Eastvale in Riverside County has been cruelly hammered at just the wrong moment. On the cusp of new commercial development, when Eastvale sought to attract business to its modest main street, Omicron threw a smothering blanket over the city's bureaucracy. In the state's second youngest city, encouraging growth is a high priority. That means streamlining the creaky and Byzantine civic process, Byzantine, the Byzantine. Okay, Byzantine. There's a new word for me. By streamlining the creaky and Byzantine civic process of approving permits, scheduling inspections, and issuing business licenses. Thank you, John.
Yeah, there was a whole empire named the Byzantine Empire. You should have covered it in history. But anyway, this is from Politico. Biden inches back toward Michelle Obama's school nutrition standards. What USDA is rolling out today is a so-called bridge rule to help schools slowly get back to meeting basic nutrition rules over the next 2 school years. The rule imposes slightly stricter limits on sodium, requires more whole grain rich items to be served, think hamburger buns and breading on chicken, and keeps allowing schools to serve 1% flavored milk, but it staves off any bigger changes for a few years. The policy keeps some of the changes the Trump administration had made. For example, under the Obama administration rules, only non-fat flavored milks were allowed. The Trump administration allowed 1% flavored milks. The Biden administration is keeping that change for now. On sodium and whole grains, Biden is basically splitting the difference and moving schools closer to the old Obama era standards. The overall goal is to help schools stabilize their nutrition programs, many of which have been losing money as food and staffing costs have soared. In the meantime, USDA is planning a total reboot of nutrition standards for school meals that will likely not take effect until the 2024-25 school year. You know what? When I was a kid, we didn't worry about nutrition. First of all, nobody really knew anything about nutrition. My doctor, who was a great doctor, I mean, in terms of being sympathetic and personally knowing all her patients, actually once told me that, breakfast cereal, which back then was 50% sugar, was just a fine and dandy breakfast. But you know what? Nobody was fat. We all ran, we all jumped, we all played sports. We were always exercising. And when you came home from school, the first thing you did was change out of your school clothes, get into your play clothes and go in the street and play until sunset. So I don't know what happened to all those kids. I know my kids did that. None of my kids were fat. They all played sports. So I don't understand, maybe everybody decides that the only thing that matters in life is getting a high SAT score and you should sit on your couch and just do your schoolwork and not throw a ball. Beats me, Steve.
John, the answer to your question, what happened, is called the home computer. But that being
well, I don't really buy that. I'm sorry, Steve. I see that all the time. Yes, I know it's addicting, but so was TV when I was growing up, and everybody blamed TV when I was growing up. They said, "Oh my God, we're raising a whole generation of idiots. They're all just sitting in front of the idiot box and they're not going to go anywhere. They're not going to do anything. Well, it's in the nature of kids to want to play. I mean, I'm sorry. I don't know how somebody took it out of them. Yeah, we had TV and everybody liked TV and everybody wanted to watch the best show or the latest show, but I don't get it. I mean, kids are naturally active if you leave them to their own devices. I mean, they go out in the street, they play, they run. It's just beyond me that this happens.
The home computer now is like food, John. You can send someone to bed without dessert, but you don't want to say you're not allowed to eat all day. Back when you and I were growing up, you can say you're not allowed to watch TV for a week. But with computers, you can't say in this day and age, you're not allowed to use the computer for a week. Kids use it for school. Adults use it for business. In that manner of speaking, it's like food. You have to use it. It's just a question of how often and what you're using it for. Basically, how much time are you sitting, as you said, on your ass? So
yeah, I mean, I find it incredible that people don't get out and play sports. I mean, really, I don't care how academically oriented you are. I mean, I did pretty well in academia, and I was always playing sports. And I played. Even I wasn't on teams in high school. I was playing tennis. I was playing golf. I was running. I was doing things to keep active. Even though, and I was like my debate partner and I were the best debate team in California. Okay. We were academically oriented, but my high school, which was academically oriented, we won all the city championships in San Francisco. I mean, there was no contradiction between being the best academic school and being the best sports school. I mean, it's just inconceivable to me that when you're young, you wouldn't want to be active. They've done studies and nobody wants to deal with it, but the studies say, guess what? Fat kids come from fat parents. Gee, what a shock.
And there you have it. And that's going to do it for another edition of Work Comp Matters. Much thanks to my co-host, John Scully in Munich, Germany. Kudos to Scott Walton of legendary Uncle Studio. Best wishes. And again, thanks to all the good people at mancavepodcasting.com. My name is Steve Appel. We'll see you again Friday, 12 noon live for another edition of Work Comp Matters. Bye, everybody.